I'm Dr. Tracy Standridge of Standridge Clinic in Owasso. I appreciate you visiting our website. I want to explain to you why in our office we tell our patients we get you well beyond chiropractic. One tool that we use to do that is disc decompression. We use the DRX 9000. We use that tool to address disc bulges and herniations, both in the low back and the neck. You may be asking yourself, am I a candidate? Can it help? Is it effective? Is it safe? Pertinent questions that must be answered. I'm going to answer those questions for you and hopefully give you information that empowers you to make good quality decisions for your health. Am I a candidate? That's what people normally come in asking. And most people are. The one reason I could think someone wouldn't be is if they've had spinal fusion surgery and been left with two segments fused together with or without the use of hardware. At that point we have to be very cautious. Beyond that, age is not a limiting factor, gender is not a limiting factor, severity of the injury is not a limiting factor. I've seen few people who are not a candidate or couldn't consider using disc decompression. Is it safe? Is this table safe for you? And I have an enthusiastic yes to offer. After 4.5 years, I can't say anything but that it's safe. We do the disc decompression both on the neck using the headpiece to decompress the discs in the lower neck following an injury, a car wreck or something of the sort, some kind of trauma. And then back down here toward the feet where I'm standing, we do the disc work on the lumbar vertebra. Now on the outside, the patient feels it's just pulling and then the table releases and then it pulls and releases, and it's all timed and operated by the computer program. And then we target the specific disc that we want to use. But on the inside, that's what's important. And this is why we like to say that we get you well beyond chiropractic. Is historically, chiropractors have worked on these posterior joints. We're all familiar with that, the snap, crackle, pop, and that's wonderful. It's helped people for over 100 years. But now with this table, what I can do is decompress that bulging disc. You can see it right there. And when we take and remove the bulge from that disc, it just opens up and there's no more bulge. So combining the table then with traditional chiropractic adjusting, we truly get you well beyond chiropractic care. It is safe, but that's a little explanation of what's going on inside you. Another frequently asked questions is, what about surgery? Well, if we can't get it done using this machine, chiropractic care and all of our rehab procedures, you may very well need surgery. You and I will sit and discuss that, and if it's necessary, I will emphatically tell you you're going to have surgery. Regarding epidural steroids, they're wonderful for pain control. In fact, the injection coupled with the DRX frequently is a wonderful protocol because the medication numbs and sedates the pain, thereby allowing you to move faster through the program and using the DRX. So that works. So we made the investment in the DRX 9000 because nothing for myself or my staff truly gives us the reward like seeing someone who's hurting return to normal life, pain-free, enjoying their family, their children, their grandchildren, whatever the case may be. That's why we went down this road. That's why we have graduated beyond just chiropractic care to now doing disc decompression, why we say we want to get you well beyond chiropractic. There are many options in my office for you to afford your care. Our number one goal is to get you well. My staff will figure out a way for you to afford it. Each case is handled on an individual basis. No two cases are the same. We want the option and the opportunity to help you if you'll give us a chance.